Hey guys, welcome to another video. Today we'll be talking about aneurysm. We'll be covering the symptoms and diagnosis of aneurysm, treatment options, and preventative measures. So let's get started. So what is an aneurysm? An aneurysm is basically a bulge or ballooning in a blood vessel. Aneurysms can occur in any of the blood vessels in the body, but they are most common in the brain, also known as cerebral aneurysm, the aorta, aortic aneurysm, and the peripheral arteries, known as peripheral aneurysm. Aneurysms can form as a result of weakened blood vessel walls. Factors that can contribute to the development of an aneurysm include high blood pressure, smoking, genetic predisposition, and certain medical conditions like Marfan syndrome. Aneurysms can be classified based on their shape and size. Circular aneurysms are shaped like a sac or pouch and are the most common type of cerebral aneurysm. Fusiform aneurysms are elongated and occur in the aorta. Dissecting aneurysms are caused by a tear in the inner layer of the artery and can occur in the aorta or other arteries. Aneurysms can be dangerous because they can rupture, leading to severe bleeding and potentially life-threatening complications. It is important to monitor aneurysm and to seek prompt medical attention if symptoms occur. Treatment options for aneurysm can vary depending on the location, size, and overall health of the individual. Here are some common symptoms of aneurysm. The signs and symptoms of an aneurysm can vary depending on the location and type of aneurysm. In some cases, aneurysm may not cause any symptoms and are only detected through imaging tests for other reasons. However, in other cases, aneurysms can cause a range of symptoms including headache or neck pain, blurred or double vision, sensitivity to light, loss of consciousness or seizures, difficulty speaking or understanding speech, chest or back pain, and shortness of breath. If an aneurysm is suspected, imaging tests are typically used to confirm the diagnosis. This may include CT scans, MRIs, or ultrasounds, depending on the location and type of aneurysm. In some cases, a cerebral angiogram may be needed, which involves injecting a dye into the blood vessels and taking X-rays to visualize the blood vessels. It is important to seek medical attention if you experience any symptoms that may be related to an aneurysm, as prompt diagnosis and treatment can help prevent complications such as rupture. If you have risk factors for an aneurysm such as high blood pressure or a family history of aneurysms, it is also important to discuss screening options with your healthcare provider. Now, the treatment for an aneurysm varies depending on the location, size, and overall health of the patient. In some cases, aneurysm may not require any treatment and are monitored with routine imaging tests. However, if the aneurysm is larger or causing symptoms, treatment may be necessary to prevent rupture and other complications. The treatment options for aneurysm include medication, surgery, and minimally invasive procedures such as endovascular repair. Medications such as beta blockers, calcium channel blockers, and angiotensin receptor blockers may be used to lower blood pressure and reduce the risk of rupture. Surgery may be recommended for aneurysms that are too large or growing rapidly, or for aneurysms that have already ruptured. Surgical options include clipping, in which a small clip is placed on the base of the aneurysm to prevent blood flow, or coiling, in which a small coil is inserted into the aneurysm to block blood flow. Minimally invasive procedures such as endovascular repair may also be an option for some patients. These procedures involve inserting a catheter into the blood vessel and using a stent or coil to block blood flow to the aneurysm. The choice of treatment depends on various factors including the location, size, and shape of the aneurysm, as well as the patient's overall health and preferences. It is important to discuss the risks and benefits of each option with the healthcare provider to determine the best treatment plan for an individual patient. Now coming to the preventative measures. There are several lifestyle factors and preventative measures that can help reduce the risk of developing an aneurysm. These include maintaining a healthy blood pressure. High blood pressure can increase the risk of developing an aneurysm. So it's important to keep blood pressure levels within a healthy range through lifestyle changes or medication. Second is quitting smoking. Smoking can damage blood vessels and increase the risk of developing an aneurysm. So quitting smoking is an important preventative measure. Third is managing conditions such as diabetes and high cholesterol. Conditions that affect the health of blood vessels can increase the risk of developing an aneurysm. So it is important to manage these conditions through lifestyle changes or medication. Lastly, screening for aneurysm. Individuals who are at a higher risk of developing an aneurysm, such as those with a family history of aneurysm or certain genetic conditions, may benefit from screening tests such as ultrasounds or CT scans. In addition to these preventative measures, it's important to seek prompt medical attention if symptoms of an aneurysm occur, such as sudden severe headache, neck pain, or loss of consciousness. By taking steps to prevent aneurysm and seeking prompt medical attention when necessary, individuals can reduce their risks of complications and improve their overall health.